Most common cause of sudden cardiac death in adults 35 years in India. Hypertrophic obstructive cardiomyopathy. Best initial drug for stable narrow complex AV-NRT? Adenosine 6 mg rapid IV bolus. In STEMI, time window for primary PCI door to balloon in guideline-directed therapy, somewhat 90 minutes. Voltage criterion for LVH in the Sokolow-Lyon index, SV1 plus RV5 over V6 equals this much. Drug that reduces mortality in HFrEF but is contraindicated if HR is less than 60 BPM. Ivabradine. Bernoulli equation, PG equals 4V squared, is used in echocardiography to calculate peak gradient across which valve most commonly? Aortic valve, aortic stenosis. Mutation in Marfan syndrome affects which protein leading to aortic root dilatation? Fibrillin 1. Kussmaul sign, paradoxical JVP rise on inspiration, is seen in constrictive pericarditis, and which cardiomyopathy? Restrictive cardiomyopathy. Doc for torsades de pointes due to prolonged QT, intravenous magnesium sulfate. Most sensitive marker for reinfarction within 24 to 48 hours after initial MI? CKMB. Epsilon wave on ECG is pathognomonic of which inherited cardiomyopathy? Arrhythmogenic right ventricular cardiomyopathy. Pulsus paradoxus, over 10 mm of Hg fall in SBP inspiration, is classic for cardiac tamponade and which severe respiratory condition? Severe acute asthma. Viva, what is the target LDL-C milligrams per deciliter after MI per latest ESC 2023 guidelines? Start 55 milligrams deciliter or less than 50% reduction. Holosystolic murmur at apex radiating to axilla corresponds to which valvular lesion? Mitral regurgitation. First-line antihypertensive and pregnancy-induced hypertension with BP equals 160 over 110 mm Hg, intravenous labetalol. Drug-causing tree bark appearance of aorta in tertiary syphilis. It is the pathological effect of syphilis itself, not a drug. Underlying cause, obliterative endarteritis of vasa vasorum. Prinzmetal variant angina is treated acutely with sublingual nitroglycerin and prevented with calcium channel blockers. BNP is secreted predominantly from which fart chamber? Ventricles, especially left ventricle. Give one absolute indication for prophylactic endocarditis cover in dental extraction. Previous infective endocarditis. Which valve is most commonly involved in IV drug-related endocarditis? Tricuspid valve. Tall A waves on JVP denote resistance to right atrial emptying. Classic lesion? Tricuspid stenosis. Name the scoring system guiding anticoagulation and non-valvular AF. JH2DS2 VASC score. In a young patient with syncope plus prolonged QTC, DOC for prevention, propranolol, beta blocker. Most common congenital cause of systemic hypertension, coarctation of aorta. Beck's triad for tamponade, hypotension, muffled heart sounds, and raised jugular venous pressure. Gold standard test to diagnose pulmonary arterial hypertension, right heart catheterization. Which lipid-lowering drug raises triglycerides and shouldn't be added if TG is higher than 500? Bile acid sequestrants, example cholestyramine. Wide, fixed, split S2 suggests atrial septal defect. Water hammer pulse is typical for regurgitation, aortic. Earliest ECG sign of hyperkalemia, peaked, tall T waves. Doc for rate control in AF with concurrent heart failure, EF less than 40%. Carvedilol or metoprolol succinate, beta blocker. Class IC antiarrhythmic contraindicated post-MI due to proarrhythmia, flecainide. Stokes-Adams attacks are caused by intermittent block at which level? Complete third-degree AV block. Carvalho sign, increased murmur intensity on inspiration, is diagnostic clue for right-sided murmurs, classically tricuspid regurgitation. P2 louder than A2 over pulmonary area indicates pulmonary hypertension. Which biomarker differentiates cardiac versus non-cardiac dyspnea in ED? NT-proBNP. Doc for acute pericarditis with elevated troponin, myopericarditis, high-dose NSAID, e.g. ibuprofen plus colchicine. Drug that reduces mortality in STEMI if given within 24 hours but contraindicated in HR less than 60 or asthma. Break time 400 milliseconds, beta blocker. Heart sound heard in early diastole, caused by rapid ventricular filling, ventricular S3, physiological in young adults, athletes, and pregnancy. Echo finding hockey stick mitral leaflet suggests which etiology? Rheumatic mitral stenosis. Sodium nitroprusside toxicity leads to accumulation of which ion? Cyanide. Cardiac enzyme that appears first after MI, within 1 to 3H, myoglobin. Therapeutic INR target for mechanical mitral valve, 2.5 to 3.5. Ideal valve for pregnant woman requiring replacement to avoid warfarin embryopathy, bioprosthetic valve. Drug combination sacubitril plus valsartan acts by inhibiting neprilysin, sacubitril, and AT1 receptor valsartan. Ejection systolic murmur that increases with Valsalva indicates which cardiomyopathy? Hypertrophic obstructive cardiomyopathy. Friedreich ataxia is associated with which congenital heart lesion? Hypertrophic cardiomyopathy. Which prostaglandin keeps ductus arteriosus patent in TGA neonate? Prostaglandin E1, alprostadil. Doc for digitalis-induced ventricular arrhythmia resistant to lidocaine, phenytoin. UCG delta wave implies pre-excitation via bundle of Kent syndrome, Wolff-Parkinson-White syndrome. Drugs that improve survival in chronic HFrEF, 3 classes: ACE, ARB, ARNI, beta blocker, mineralocorticoid receptor antagonist. Absolute contraindication to thrombolysis in acute MI, any prior intracranial hemorrhage. Weight-based unfractionated heparin bolus dose before PCI, 70 to 100 IU per kilogram, max 5,000 IU. Murmur of VSD is pansystolic at left lower sternal border and has thrill, palpable. Most specific sign of left-sided heart failure on chest X-ray? Curly B lines. Preferred anticoagulant in CKD stage 5, eGFR less than 15 with AF, warfarin. Endocarditis prophylaxis antibiotic for dental extraction in penicillin allergic. Azithromycin 500 mg PO 1 hour before. Antihypertensive that causes pedal edema via arteriolar dilatation. Amlodipine, dihydropyridine CCB. Speak. Cardioselective beta blocker safe in COPD? Metoprolol, metoprolol. Renin-angiotensin-aldosterone system inhibitor causing hyperkalemia when combined with ACI? Spironolactone. COPD severity is staged by which spirometric parameter? FEV1 percentage predicted. Drug improving survival in COPD with frequent exacerbations. Inhaling? Inhaled long-acting muscarinic antagonist, tiotropium. Classical triad of Cardigan syndrome, bronchiectasis, chronic sinusitis, situs inversus. Most common cause of community-acquired pneumonia worldwide? Streptococcus pneumoniae. CURD 65 score. The R stands for respiratory rate greater than 30 minutes per second. Doc for atypical pneumonia due to mycoplasma, azithromycin. Non-productive cough, bilateral reticular opacities plus clubbing suggests which ILD? Idiopathic pulmonary fibrosis. Anti-fibrotic drug that inhibits TGF-beta used in IPF, pirfenidone. Tension pneumothorax, immediate management step, needle thoracostomy in second ICS midclavicular line. MAN2 test induration is equal to X millimeters is positive in HIV equals 5 millimeters. Gold standard test for obstructive sleep apnea, polysomnography. Which acid-base disorder? pH 7.25, PaCO2 60 millimeters mercury, HCO3 minus 26 milliequivalents per liter. Acute respiratory acidosis. Low DLCO differentiates emphysema from chronic bronchitis. Present in emphysema, decreased, normal in chronic bronchitis. Drug of choice for acute asthma exacerbation unresponsive to SABA. Systemic corticosteroid, IV methylprednisolone. Restrictive defect on spirometry, FeMe1 FVC ratio is 0.8, normal or increased. Pleural fluid ADA times 40 U per liter suggests which etiology? Tuberculous pleural effusion. Most common cause of exudative pleural effusion overall? Tuberculosis. Paraneoplastic SIADH is classically associated with which lung cancer? Small cell lung carcinoma. Target SpO2 in acute COPD exacerbation to avoid CO2 retention? 88 to 92%. Speak prosody, rate 20%. DOC for prophylaxis of high-altitude pulmonary edema, HAPE, break time 400 milliseconds, nifedipine, slow release. DLCO is increased in which obstructive airway disease? Asthma. COPD Gold D first-line inhaler combination? LABA plus LAMA. Post-tubercular bronchiectasis treatment cornerstone? Regular chest physiotherapy and postural drainage. Hypercalcemia in sarcoidosis is due to elevated portion production by macrophages. 1-alpha hydroxylase, portion, increased calcitriol. Most common occupational ILD in India, silicosis. Classic triad of Wegener, GPA, sinusitis, lung nodules, and glomerulonephritis. P-ANCA positivity with asthma and eosinophilia points to Churg-Strauss syndrome, EGPA. DOC to stop bleeding in massive hemoptysis when localized lesion, bronchial artery embolization. Ampton's hump on CXR indicates pulmonary infarct, usually due to embolism. Which organism causes pneumonia in alcoholics with current jelly sputum? Klebsiella pneumoniae. Bronchiolitis obliterans organizing pneumonia, BOOP, responds dramatically to corticosteroids. Fungal infection causing fungus ball in old TB cavity, aspergilloma, Aspergillus fumigatus. Light's criteria, pleural fluid protein serum protein greater than equal indicates exudate, 0.5. Drug regimen for latent TB infection in HIV-negative adult, isoniazid, 300 mg daily, times 6 months. FEV1 improvement equals 12% and 200 milliliters after bronchodilator signifies reversibility, suggestive of asthma. Bronchiectasis, HRCT hallmark appearance, signet ring sign. Which adult vaccination is advised for COPD patients to cut exacerbations? Pneumococcal polysaccharide, PPSV 23. Hypersensitivity pneumonitis, acute exposure causes which type of hypersensitivity? Type 3, immune complex. ECG PsyQ3T3 pattern suggests acute pulmonary embolism. DOC for prevention of DVT in postoperative hip replacement patient. Low molecular weight heparin, enoxaparin.